Hi, this is Dr. Michael Lau. In this presentation within the series Understanding Beauty Tech presentations, I would like to discuss with you the use of exosomes, stem cells, PRP, in association with microneedling in taking care of skin rejuvenation and hair loss. So as you might have known, microneedling is very effective by itself in skin rejuvenation, skin tightening, and skin texture. However, in combined with other agents, in this case exosomes, stem cells, and PRP, to help specifically with skin rejuvenation and correcting hair loss. Just to inform you why I'm qualified to lead this discussion, I'm actually trained in physics and chemistry, graduate studies and degrees, and prior to medical school. And I've been using physics and chemistry and biology as a physician. I'm one of the first ones using laser for surgery in the Pacific Northwest more than 30 years ago. I also have been involved in developing different devices, in beauty devices. For example, the one shown here, the Genu Bioscience device, is an ultrasound device that can help drive skincare product into through the skin to achieve skin rejuvenation. I'm the co-developer and co-founder of the company. So as I've said, I'm a cosmetic surgeon and aesthetic medical specialist. Trained both gynecology and cosmetic surgery, and however, I'm a cosmetic chemist and device developer as well, especially the beauty device. I have advanced degree in chemistry and physics, and also technology management, MBA. And then I'm a research scientist, actively engaged in studying sense, perception, attraction, beauty, neuroscience, and medical devices. I'm on the faculty at the University of Washington School of Medicine, and also I'm a visiting scholar at the University of California, Irvine in the School of Engineering, both biomedical engineering and electrical engineering and computer science. And I've co-authored multiple peer-reviewed journal papers and also U.S. patent and patent applications. So let's first talk about microneedling. I'm sure you're aware of what microneedling is. Basically, using a device, we create micro punctures that will only go to 0.5 to 3 millimeter, most of the time 1.5 millimeter, very shallow, control micro injury to the deeper skin layer. That the injury will actually generate cascade or healing processes, including releasing of wound healing factors and growth factors such as PGF, platelet-related growth factor, and connective tissue activating proteins to generate collagens, elastinins, and tighten the skin and change the texture of the skin. And then, microneedling can be enhanced by using other treatment agents to do things specifically as well. So microneedling can help with smoothing out fine lines and wrinkles, reduce large pore, improve skin elasticities, reduce sun damage and dark spots and patches, and also help with acne scar and stretch marks. And as a adjunct therapy, can be added to the microneedling to enhance effectiveness in specific applications. So what are adjunct therapies that can be used with microneedling to enhance its effectiveness for specific applications? Applications such as improved hair loss, skin rejuvenation, and skin tightening. And the adjunct treatment options such as PRP and stem cell and its derivatives, exosome and the derivatives, and then also our radio frequency, RF. I'll go over each of them in the following slides. So the first one I'm going to talk about is PRP. So what is PRP? PRP is an abbreviation for platelet-rich plasma. Platelets are a component of the blood usually functioning to help with coagulation and also healing. We can concentrate the platelet component of the blood in the plasma fluid component of the blood, and we basically draw blood from you, takes a couple tablespoon only, and then systematically spin it down, centrifuge down, to get the layer rich in a platelet. That's what I call platelet-rich plasma. And the mixture is full of powerful growth and healing factors. So that's very specific in extracting those particular factors that's useful in helping healing and regenerating tissue. So those bioactive factor can be used with microneedling in treatment and also in cosmetic surgery. And actually, I started using PRP during my training 25 years ago in cosmetic surgery, and we were one of the first one in the country that used PRP in breast augmentation using fat graft, fat transfer. So that was very interesting, and I've been using PRP in those cosmetic applications. Well, PRP is completely safe. It's from your own blood, so your own cells and your own cell factors, so no worries there. So specifically, PRP can be used with microneedling to treat hair loss. It would stimulate hair growth. So this is a process that FDA has agreed to permit it to do under the FDA regulation. Is performed by a physician with intention to practice medicine. So there are many growth factors, healing factor in the PRP, your own factors, that will stimulate hair follicle to grow new hair. And the effectiveness of such is well documented in hundreds of paper literatures, one listed on the slide at 2022, but there are many of them to document the success and efficacy of using PRP with microneedling for hair loss. Of course, another application of using PRP with microneedling is even more famous, the vampire facial. Basically, we use the PRP from you and use microneedling to treat the face and neck, the healing factors, and the growth factors can help enhance the cosmetic effectiveness to make the skin look younger, firmer, and with better texture. It's definitely superior to commercially available growth factor serums by using PRP, your own PRP. You can see the result more prompt than anything else. It needs less healing time. As I said, could be done for the face, neck, chest, and other body parts as well. So now we're going to new technology that's being popularized, and then people have been searching for the use of those new technology to help in cosmetics. So first one is stem cells and their derivatives. So stem cell is cells in the body that's multipotent. That means those cells can develop into all different kinds of cells, cell types that make our body. Just think about, embryo, how it develop into different things, hair, eye, body, muscle, nerves, etc. So they're multipotent. And also stem cell has the potential to repair and replace cells that are missing or dysfunctional. Now, for use, stem cell can be harvested from adipose tissue, fat cells, bone marrow, umbilical cords, and amniotic cells. Now, so those cells are generated into cell cultures and extract the derivative or the cells themselves in applying in medicine and cosmetic applications. So what's the FDA view on using stem cells? FDA see this as still experimental. That means there's no approved commercial product per se out there in cosmetic application using stem cell or the derivatives. But there are investigational study that have shown efficacy in improving hair loss and skin rejuvenation using stem cells or the derivatives. Another new trend is called exosome. Exosome is basically the part of extracellular vesicles. So what's that? So basically, they're little small, tiny sphere of lipid membranes that the cell produce and expel into the extracellular area that carry nucleic acid, protein, lipid, metabolites, including growth factors and healing factors. Those exosomes are used as a mediator to communicate close by and long distance cells to encourage the tissue to grow and repair. So that's very powerful. It's a signaling device as well. Well, most of commercially available exosomes are allogenic. It means not from your own body. Autologous it means from your own body. Allogenics from sources outside your body. That could be from plants, people have used that, or from pool, such as umbilical stem cells or umbilical cord stem cells or bone marrow stem cells, fat stem cells, etc. But since they're not a full cell, they don't have the immune factors that would trigger rejection by your body. So it's pretty safe in that regard. But however, FDA still think the exosome treatment is experimental. So there are investigative studies showing some efficacy in improving hair loss and skin rejuvenation. So what's the current assessments about all the things you can use to work with microneedling to help in skin rejuvenation and also helping hair loss? Well, for treating hair loss and skin rejuvenation in conjunction with microneedling, PRP is only one acceptable to the FDA for hair and skin applications. If it's done as a medical procedure under the care of a medical doctor, PRP has a long-standing history of efficacy over 20 plus years. And then in the recent years, efficacy in treating hair loss and skin rejuvenation. Now, on the other hand, stem cell exosomes, EVs, or the derivatives for skin and hair applications, they're all considered experimental by the FDA. There's some investigational studies supporting their efficacy. They're allogenic, so they have varying different ingredients and characteristics. They're all different. You look at the label of ingredients, even though they call themselves stem cell derivative or EV or exosome derivative, there are many things in it, and they're from different sources of stem cells. So I think you really need to talk to your aesthetic provider to discuss the benefit of using those treatment modality. The PRP is well established, so we can trust that. The other ones, depending on the sources and how it's being processed, it might be helpful to understand that before you embark on the treatment using those newer technologies. So if you're curious to learn more about beauty tech, the various types besides devices and new biotechnology, please subscribe to my video library. That's under the library. You have one section, it's called Understanding Beauty Tech series, and that will update once a week to give you the latest trend in beauty tech. Thank you again for your attention. Take care.